We are here with Mr. Cerquoni. We are going to be using an inline valve with the vent, and he is very, very excited to do so. I am Jessica First, the therapist, or speech therapist.
I'm Diana, respiratory therapist.
I'm Sam, respiratory therapist.
I'm Liz, RN.
And just a little bit about Mr. Cerquoni. He is 67 years old. He was admitted to an outside hospital about 8 weeks ago with complaints of shortness of breath for acute on chronic respiratory failure. He ended up being intubated. He failed breathing attempts and got a trach about a month ago. His hospital course was complicated by acute renal failure, left lower lobe pneumonia, and septic shock. He is very excited to use the valve because he feels anxious not being able to communicate his wants and needs. A little brief history about him: he does have a history of COPD on Homo 2 with 2 to 3 liters. He quit smoking about 7 years ago, and he uses a BiPAP at night, and he was completely independent prior to this hospitalization.
Okay, Mr. Cerquoni, we're going to put this warning label on your pilot balloon. That way, if anyone comes in, they will know that you are trialing the speaking room.
As a nurse, I always look for this warning label when I come in the room. The warning label states that the pilot balloon must be completely deflated before the Passamere valve can be placed, and that if it is not completely deflated, then the patient cannot breathe.
Get your volumes and we get your volumes back on the ventilator. We're going to deflate this, which takes the air out. That way, the air can go up past your vocal cords. That will allow you to have speech. It may also allow you to have some of your senses back, such as taste and smell. Okay, now that we have you in an upright position, I'm just going to suction you, okay, to clear out your airway before we get started.
How did that feel? Okay, sound much better. Okay. And we're
It
here
didn't
to
really
help.
sound like we could hear your voice very well, so we're going to do some things to see if we can increase the volume. Okay, so first thing I want you to do is just take a big deep breath through your nose and breathe out through your mouth. And you're going to do it again. Good. This next time, you're going to breathe in through your nose, and when you exhale, you're going to say hi. So it's going to be like this. Hi. Okay, so you want to use all that air to push that sound out. Okay, so in through your nose. Good. How does it feel to talk?
Just wonderful. Just wonderful.
Has it been difficult to communicate your wants and needs without this valve?
Almost impossible.
Yeah. How have you been doing it without the valve?
Lip reading.
Yeah, lip reading. Any writing or anything like that?
Writing.
Trying to.
Mostly lip reading.
So this is opening in a whole new world for you.
Yes.
Yes. You're very happy.
Very happy.
Okay, thanks guys.
Self-reliance.
Yes, beautiful.